and it's time for us to have that conversation. Many have had their say, and of course tonight we are hosting Dr. Deborah Barasa, the Cabinet Secretary, Minister of Health. Has never done any other TV interview before. This is her first. Waziri, karibu sana to KBC. How are you doing?
Thank you so much. I'm doing well, and
yes.
Thank you, John, for hosting us.
Karibu sana.
Yeah.
You've seen the kind of reactions greeting the rollout of SHIF under SHA, and you've had Kenyans, joking around with SHA. Question is, how is your ministry dealing with these concerns that are emanating from members of the public regarding the rollout of SHIF?
Absolutely, that is a great question. First of all, I'd like to say that we have 14.8 million Kenyans who are currently registered under the Social Health Authority. So within just a short period, less than 50 days, we are having many Kenyans enrolling or registering into SHA, which is quite promising. And even the amount of money that we are collecting right now is quite promising. We are seeing sustainability in this program. And so we are confident that Kenyans will have affordable, accessible quality of care. And definitely, with a new program, seeing that it is nationally implemented, it is a paradigm shift, it's a transformative agenda, there are challenges that may come with it. And so yes, while we are rolling it out, we had a few challenges, including the system challenges that have actually been addressed. I've been able to visit multiple counties. And I've
no, go ahead.
Yeah, I've seen it's efficient and it's working quite well. So we appreciate the great work that the team is doing in terms of improving the digital health. Equally, one of the areas that we saw is the specialized groups, like the teenage mothers. Teenage pregnancies, they did not have identification cards, so they could not access the services. And so what we are doing is improving that, is having unique identifiers for teenage mothers, for refugees, for people who had mental illnesses or specialized cases like emergency cases, so that we ensure that they are seen promptly, and we have health service delivery in those specialized groups. And so with all these challenges we continue with training, we continue with sensitization, we continue to improve the digital platform. Ultimately, we are seeing that we'll have a seamless implementation, and universal health coverage will actually be a tangible reality in Kenya. Yes.
You're confirming to Kenyans tonight that you don't need an ID for your registration to the SHIF?
For specialized groups, say for instance teenage mothers, teenage mothers will not have an ID. At times you may have a refugee who needs to have access to care, and they may not have the appropriate identification. Equally, the mental illnesses who are just maybe picked from the streets, or street children, okay, or street adults, yeah. So those are special or unique cases, and we are saying we are leaving no one behind. Every Kenyan must be able to access quality care services, and so that is why we are saying that was a challenge before, because we were relying or dependent on the identification card. Even as the immigration ministry addresses the issues of identification cards, we are saying Kenyans should be able to access services no matter who you are. And so that is why we are having those leeways, we're having those discussions, and we're having unique identifiers. For the NHIF, again, the motivation was again a challenge. They were not confident, they were not well informed if they will be onboarded or not. And so we have engaged them. We see that there are over 1,700 NHIF staff, and we have 70 NHIF branches, which we are now calling the Social Health Authority branches. So a ratio of 1 to 70 healthcare providers. And indeed, these are people, human resource capacity that we can use in terms of strengthening the healthcare providers, strengthening and informing the community, informing, being used for sales and marketing of the Social Health Authority, ensuring that employers onboard their employees, among others. So again, we are encouraging the NHIF staff. We are having a seamless transition. We are telling them that none of them will lose their jobs, and they will keep the very same salary that they will have. So we have had critical measures in place together with the public service to ensure that no one will lose their job. So now they are motivated, now they are going to the field. We are ensuring that they are engaging the healthcare providers and ensuring that gradually, slowly by slowly, Kenyans are informed about social health authority.
You've mentioned about NHIF, and let's get this out of it, because these are one of the questions that are coming from members of the public. Why it was necessary to move from NHIF to SHIF?
Yes, that is a wonderful question. First of all, NHIF was really focused on the employed. Yeah? Very few Kenyans, about 20% of Kenyans would actually access these services. So with the universal health coverage, we are saying that we should leave no Kenyan behind. So everyone should be able to access affordable quality care. And that is why social health insurance or social health authority came in, so that all Kenyans can be able to access services, no matter your class, whether you're poor, whether you're vulnerable, whether you're disability, depending on your financial capacity. There's a proportion of contribution that you're able to make, and if you're unable to make the very same contribution, you can still access the very same services that a rich person can access. So for me, even coming from that medical background, I have seen patients who come into a facility and they are told to, you need to pay 500,000 shillings, you need to pay a million shillings for a certain service. And you see them just going home and, going to die at home. But with this, we are assuring Kenyans that they'll be able to access the very same services that the rich people are accessing. And so what we are saying, let us on board, let us register so that we can access these services.
You're mentioning the benefits. My question to you, in your assessment of a ministry, as a ministry, do you feel like there's a general misunderstanding around SHIF and the benefits thereof?
Absolutely, absolutely. There's a misunderstanding. For instance, in the political elite, we were expecting that they would fully understand the scope and of the benefits. This is because, first of all, as we had said earlier, the Social Health Authority has three funds. The Primary Health Care Fund, the Emergency, Chronic and Critical Illness Fund, as well as the Social Health Insurance Funds. So the ones who will benefit more are at the county level, because for every facility, let's say for instance the primary health care facility, they will be able to receive the Primary Health Care Fund and equally the Emergency, Chronic Critical Illness Fund. And for the higher levels of care, for Social Health Insurance Fund, depending on the claims that have been processed by a facility. And so the facilities are the one that would benefit, and that is why we are calling upon the counties, the political elite, MPs, senators, MCAs. Let us encourage people to register. And for the capitation, for the number of people you register within your constituency or your county, then you'll be able to get the capitation. So that is 900 shillings per person. So the more they register, the more they are seeing patients, the more they are likely to get these funds, and they are likely to improve the capacity of their facility, meaning that they'll have better human resources, medications will be available, services will be available, equipments will be available. And that is why we are calling first upon the political elite to join us in this. Equally for the religious leaders, because we are looking at affordable, accessible care to all Kenyan. The Kenyan people. And yes, we see that with the NHIF previously, what was happening is that the level 4, 5, and 6 were the ones who would benefit more in terms of receiving Primary Health Care Fund and also NHI, that is the National Health Insurance Funds. But with this system, we are also strengthening the primary health care regions, that is the dispensary as well as the health centers, and that is through giving them funds. So even for the other levels of care, they can consider having primary health care, facilities within, so that they will have that referral system and they would also benefit from the primary health care fund. So we are saying we are leaving no one behind. We are flexible to those changes, aligning with what we have said within the laws that have been developed by the ministry and of course by the parliament, to ensure that there is that strengthened referral mechanism, but everyone is benefiting from the system.
I want you to take us through the specific benefits, particularly for chronically ill patients? Because much of the concentration has been around patients who walk in and then probably finally don't end up having any form of treatment, or they have been told to pay upfront, or sometimes have challenges with payment with a shift card. And that has been the concentration. The question is, what are the other benefits, beyond this walk-in patients who get medication through the shift card? What are the other benefits for the other clusters of patients visiting our hospitals?
Yes, that's a wonderful question. And, coming from the medical profession, even as we were transitioning, we were very keen to look at the patients, the chronic patients who are being transitioned. That's the dialysis patients, the patients on cancer, chemotherapy, because those would need to have that seamless transition. So we were keeping an eye on that. And what I can inform Kenyans is that there is a lot of benefit when it comes to the social health insurance funds for chronic illnesses. Say, for instance, for renal patients. First of all, we have the preventive component, where we have our community health promoters going to the communities to look at blood pressure, sugar, among other, diagnostic indicators that would cause one to have kidney conditions. Again, there are those screening that would take place in the primary health care. And those ones, again, primary health care facilities, the investigations are really free of charge. Now, those investigations would include blood investigations, urinary investigations, among others. Now, if there's need to escalate, again, there are those investigations that are covered under social health insurance funds. And they include looking at your kidney, etc. So again, we have the pre-transplant. In case, first of all, in case a patient needs dialysis, again, we have better services when it comes to dialysis. The sessions of dialysis are increased, the amount is increased. Again, if a patient wants to go for transplant, there's the pre-transplant, and then during transplant and post-transplant. And even for the donor, coming to around over 1 million Kenyan shillings. And we have seen, actually, I was in Kenyatta National Hospital, where I was happy to see one patient who had been successfully transplanted. And the donor, who was the wife, was there. And we hope that we could even have a coverage of that story one of these days, so that patients are now informed that the agenda is transformative. We want to change the health system. We want to ensure that even the chronic illness patients are also engaged fully, and we are giving them quality care services. For cancer patients as well, we have also expanded from the screening component at primary healthcare level, coming even to the management of cases and rehabilitation. And we are looking to engage more the stakeholders, the manufacturers, the oncologists, the nurses, etc., to ensure that we have the best package for them. Previously, when healthcare providers would buy medicines, as a facility or as a healthcare provider, the cost would be high, especially for chemotherapy medications that would go up to 300,000 Kenyan shillings. But when we have bulk procurement as a ministry, we see that the costs actually decrease. We were having engagements and we were seeing costs decreasing from 300,000 to around 50,000 or 30,000. And so this is the thing that we're looking into as a ministry. How do we ensure that there is bulk procurement so that our patients are also not suffering, especially the patients who have cancer? How do we engage them? We are having a lot of support groups with cancer patients. We are engaging the various stakeholders to ensure that they have quality services. And so we look forward to having improved services. I know this the program was just rolled out recently. The Social Health Insurance Fund is really less than 50 days old. But you can imagine in 50 days, we are achieving this. How much more, at 6 months, at 1 year, etc. So we are asking colleagues, please support us. This is for the benefit of we Kenyans. Even when you retire, when you lose your job, you never know when a disease is coming, knocking at your door. So let us utilize this platform, because we are very privileged that this government, this good political will from the highest office, which rarely happens, coming from a public health perspective, it rarely happens. So when we have that strong political will to change the health sector for the better and for the best of all of us Kenyans, then we need to take advantage. We need to, seize the opportunity and ensure that we utilize it as much as possible, that ultimately will have a strengthened health system.
All right. There's some clips I want us to listen to here. And by the way, we also have testimonials of some of people really who've benefited from the works of Social Health Insurance Fund, but we'll play them later. For now, there's one of your clips responding to the critics of the Social Health Insurance Fund, but there's also what the clinical officers have been saying regarding the working out of SHIF. Let's just have a listen in.
The implementation of the new Social Health Authority has continued to face setbacks, with the Kenya Union of Clinical Officers National Chairman Peterson Wachira faulting the Social Health Authority Board for failing to register more than 1,000 health facilities. Wachira accuses the Social Health Authority Board of discriminating against the said facilities, which are under the Kenya Clinical Officers Council that offer primary health care across the country, and recognizing only hospitals registered under the Kenya Medical Practitioners and Dentist Council.
Kuna Wakenya zaidi ya milioni 4.5 ambao wametoa nje ya hii bima. Hawawezi wakapata zile huduma za afya chini ya SHA wakati tunaongea hapa. Kwa sababu kuna hospitali zaidi ya 1,000 ambazo zilikuwa zimeweza zikaratibiwa na NHIF, lakini sasa hazijaratibiwa, hazioni Wakenya kutumia hii bima ya afya, na wale Wakenya pale nje wanaumia. Na ndio unaona hata usajili unakuwa chini. Kwa sababu Mkenya anajiuliza, hii ilikuwa ni hospitali yangu, imenyimwa ile kandarasi, hawawezi wakatumia SHA kunipatia ile huduma. Mbona naambiwa nijisajili na ile bima haitanisaidia?
Wachira further noted the exclusion has impacted hundreds of patients who have requested authorization to get specialized services from facilities run by clinical officers.
Kuna wagonjwa zaidi ya 500 ambao walikuwa wanangoja kufanyiwa cataract surgeries, hawawezi wakazipata. Kuna wale walikuwa na mashida ya koo, mashida ya masikio, mashida ya mapua, ambao walifaa kuonekana na kuweza kupata zile huduma, ambao hawawezi wakazipata kwa sababu ya utekelezaji ambao unaenda kinyume na sheria pale kwa SHA Board.
The union now says it will write a petition to the Ethics and Anti-Corruption Commission to investigate into the alleged vested interests at the Social Health Authority Board.
Tungetaka kujulisha rais ya kwamba wale watu wamepatia hii kazi, kuna watu wameleta ubinafsi na ufisadi, na wanafanya Mkenya wa kawaida asiweze akapata ile huduma. Na kwa hivyo ni lazima ile board iko aidha iache kutelekeza wengine, kufanya discrimination kwa hospitali zingine. Kama hawawezi wakafanya, mimi nitamuomba rais
I'm sure, CS, you've noted that, but we will come back so that you respond. Let's just take one very quick commercial breather and then come back and continue with the conversation. Don't go too far. We're speaking with Dr. Deborah Barasa, who is the Cabinet Secretary in charge of the Ministry of Health.
Ungependa kuwa mshindi na Lucky Box? Ni rahisi sana.
Bonyeza *463# uwe mshindi.
Kwa rahisi kufika hapa, ni nguvu zake. Nilijua utafanya.
Long as tu umeingia age fulani ya puberty, umeingia umekuwa tini, it's something that is going to affect you. And today we want to talk about purity.
So I'm a minister of the word, and as a young lady, you can be invited somewhere to go and preach, and someone is going to look at you and think like, huyu sasa pia anaweza preach kweli.
Nini unafikiria ina affect matini sana?
Secular music, or rather the content that young people are listening to, is what is really corrupting them.
Kila mtu anaweza kuwa mshindi. Bonyeza *463#. Uwe mshindi.
Kuchagua box ni kuchagua chapa.
Kumbuka, kila unapocheza Lucky Box unasaidia watoto kusoma.
Mamlaka ya ukusanyaji ushuru nchini inakuletea kampeni ya umma ya G-Nice na Risiti Legit. Thibitisha risiti yako ukitumia app ya Risiti Legit, upate nafasi ya kuibuka mshindi wa zawadi kemkem kama vile shilingi milioni 1 pesa taslim, laptops, televisheni ya inchi 50, smartphones na zawadi zingine. Jumanne tarehe 19 tutakuwa Nakuru, maeneo ya Naivasha. Gilgil, Nyahururu, Olkalau, Subukia, Bahati, Langa na keshowe tarehe 20 tutakuwa Nakuru Town na viunga vyake, Njoro, Elbagon, Molo na Mau Summit. Pata app ya Risiti Legit kwa Google Play Store au App Store kwa maelezo ya kuingia katika mashindano ya Risiti Legit. G-Nice na Risiti Legit. KRA, tulipe ushuru tujitegemee.
Welcome back. You're watching the Prime Edition. We're still on set with the Cabinet Secretary in the Ministry of Health, Dr. Deborah Barasa. Before we took a breather, and of course you saw what the clinicians are talking about, but let's first deal with the issue of pending bills, because I mean it's been one of the hottest issues this last few weeks. And during the Mashujadi, the President announced a payment of about 5 billion shillings going to facilities that were owed by the defunct NHIF, but there still appears to be other pending bills. What are you doing to end that stalemate?
Yes, that is a wonderful question. And indeed, that is how we buy in the trust of our healthcare providers, by ensuring that we pay the bill. And so we are looking to pay again another 2.5 billion. Let us remember that by the end of November, we are also paying the first payment for this from the Social Health Insurance Fund, meaning all the hospitals, all the facilities that were contracted under the Social Health Insurance Fund will receive their first payment. Equally, for the Primary Health Care Fund, following the capitation, some money will also be sent. And we look also to capacitate in terms of the emergency funds. And so old debts that have actually been carried into this new government. But again, it is our responsibility, and we'll ensure that we are paying all the healthcare providers the money that is owed to them. Yes.
There was a question raised there by the clinicians regarding, I think, registered hospitals that were previously under NHIF, but then didn't find favor probably with the registration process with CHIF. Yet there were patients who were being treated probably for chronic diseases in these facilities, and now they can be able to access this medication or treatment because the hospital has been locked out of CHIF. How are you dealing with that? Because it's also a very serious complaint.
Absolutely, absolutely. We've had more than 8,000 facilities being, empaneled, again contracted. So we actually have more facilities, actually almost twice the amount of facilities that were previously under NHIF. That is why we want accessible services to all Kenyans. And so it may be that the facilities have not contracted, or maybe there could be some concerns, maybe regulatory concern. But what we are encouraging facilities is to sign the contracts, okay? So once they are signed, then they will be able, their people will be able to access these services, and then they will also access the funds. And so this is for their benefit. This is the benefit for the county governments as well. So again, they should be the ones encouraging healthcare facilities within their county to e-contract, and they'll be able to offer services to Kenyans.
All right. Ask the CS how she's handling the matter of being asked for money up front before you get treatment because she is not working. When it is not working, in instances where it is not working.
Yes. We are really working on that. And you know, that is one thing when I'm talking to the digital health colleagues, I am really tasking them to ensure that the system is seamless. So in the first 2 weeks, that was a real major issue. But currently we are seeing that people are able to pay, and they're able to access the services. As I had told you, we attempted in Kisumu and it was successful. We've attempted in Homa Bay, it was successful. So everywhere we go, we want to see, is the system really working? And those are again the challenges that come with the digital system. But gradually, as I said, we are only less than 50 days old, and we are having teams on the ground, the social health authority teams, we are having ICT officers, we are having CECs, among other people, the county teams, to ensure that the system is seamless. Any challenges that are being faced are addressed at grassroots level, and those that need to be escalated up, say for instance the identification that we talked about, are sent to a level for policy and direction, and then prompt implementation.
Much of a picture painted around Chief is a gloom picture, but is it? Let's get to hear from some of the people probably who have interacted with Chief.
Na so far hakuna kitu nimeitishwa pesa ama kuambiwa ninunue kitu yoyote na madaktari. Nimelipiwa na huduma ya SHA ambayo nilijisajili nayo. Nataka kushukuru wakurugenzi wa SHA kwa kuleta hiyo huduma, imetusaidia sana kama mama.
Mimi ndo baba mtoto. Leo nikuje niwakujie sababu ilikuwa siku yao ya kwenda nyumbani. Amelejesta kwa SHA, so naona hiyo itamkaa.
Guduliwa ni kama niko na kansa. Hiyo kansa sasa niko na session 3 kuendelea na kupatiwa dawa. Kwanza hii ndio ya 3. Wananipatianga 3 days per week. Kuna session 3. Siku za NHIF inalipa. Lakini sasa tumemigrate, tumeswitch. Naona the staff hapa wamesaidia. Imekuwa smooth. Sisi hapata shida. Kuna staff hapa wanahusika huko kindani. Nasikia tu anakuja, anataka kuniuliza maswali about the SHA, na wajibu. Na maneno inaendelea, wanafeed kwa hiyo kompyuta. Maneno inaendelea vizuri.
Huyu hapa kwa kanza ya ngozi ya screen. Nimeona matibabu imeendelea vizuri kutoka hapo. Nilikuwa kwa NHIF nikatoka nikaambiwa niingie kwa SHA, na SHA nimeona iko afadhali kuliko hiyo NHIF. Saa hii nikikuja hospitali na kuenda ikiwa ni kupima damu na vimadamu, hakuna kitu naulizwa. Na kuja hapa ni matibabu, hakuna kitu naulizwa. NHIF nimelipa ndio imebadilishwa kuingia kwa SHA, na ndio nimetumia kuanzia leo hii.
At the current our facility is offering dialysis with the SHA program. Initially the NHIF, then our bed capacity in our unit is 8. We have one in the isolation where we do infectious diseases like hepatitis B. The moment our patients are fully registered with SHA, they are so comfortable with SHA, they are at least the initial anxiety that they had about transiting from NHIF to SHA is now over. We've been able to convince them and they are taking it positively. At least I can say all of them are benefiting with the twice weekly dialysis that they are doing.
Clearly, it is not all gloom. There are those who are benefiting from the Social Health Insurance Fund, like the CSA is probably what you just need to do is to enroll on SHIF and get to figure it out yourself. But let's talk about the 300 shillings contribution. Who is contributing 300 shillings? We know, of course, for those employed, it is a one-off on their pay slip. But what about these 300 shillings?
Yes. So first of all, let me talk about the indigents. There are people in Kenya who cannot afford to pay. So using the means testing, we are able to identify and then the government will pay for them. Equally, we are using the Ministry of Social Protection to support us in that. And so what we are saying is that the needy in our community, needy Kenyans, will not be forced to pay. The vulnerable Kenyans will not be forced to pay. Mothers who come, and they're in labor, they don't have a job, their means testing is low, we will pay their premiums, not only for the antenatal, maybe for delivery and postnatal, but for the whole family, premiums for 1 year. So first of all, let us remember that the needy, the vulnerable are not going to pay. And those ones who also earn less than 15,000 again, the amount is reduced. And so we start from 300 shillings, but anyone who's 2.7 is below 300 shillings, then they pay. They don't pay anything. So you can see that we are all contributing to one pot, the rich, the poor, but having an equitable and also quality healthcare services. And as I said, because at times we hear, oh, you know, the quality is not yet there, but this is a gradual process. We are less than 50 days old, But the ultimate goal is to have quality services. After this, we are moving into the quality bill among other bills. So really changing the health sector to ensure that it is resilient and it's supporting all Kenyans. Yeah.
You've come into office when your ministry is really under sharp focus, particularly over this rollout and the transition from NHIF to SHIF. I actually sympathize with you, by the way. But then again, what would you want to be your legacy? Amidst all these things, what would you want to be your legacy at the Ministry of Health?
Yes. So I am a medical doctor, and I have practiced in various areas. I've practiced in hospitals like Kenyatta, which is the National Referral Hospital. I have practiced in the slums of Nairobi. Yes, I've worked with the international organization. And one thing that cuts across and really is dear to my heart is the concern of equity. Not all people can access quality services in this world. The needy, the vulnerable will just go home and die because the services are too expensive. So for me, it is indeed a privilege and an honor to serve in this capacity, and especially getting the highest, political will in the land so that we are really changing the health system. So for me, my legacy project is really to achieve a comprehensive universal health coverage for all Kenyans and ensuring that all Kenyans have access to affordable quality healthcare services. I also want to be remembered for having been involved in that transformative agenda of having a resilient health system in Kenya, and hopefully even have best practices in Africa and across the globe. So this is really exciting and thrilling, but we just hope that people will be able to understand that this is not only about individuals, but it's about all Kenyans accessing affordable quality services. Yes.
The tagline on KBC is Kenya is watching. I want to give you a moment on this camera here. There are Kenyans who are looking at you tonight, and they're looking at you with rays of hope because of what is happening, and particularly with the treatment under SHIF. I want you to give them your assurance as the Cabinet Secretary, Ministry of Health, on this camera.
Yes.
Yes.
So thank you very much. I want to assure all Kenyans that we are going to deliver this. What we want to tell you, please register. And again, for the political elite, for the religious leaders, for the stakeholders, we want to request for your support. Let us ensure that Kenyans are registering. Let us ensure that we are ultimately offering affordable, accessible, quality care, because this cannot be done alone. We need to hold hands. We need to bring this thing to fruition, especially when we have the highest political office in the land. We really need to work together. And I'm also calling upon the healthcare workers all around. You have seen the cases out there, and you've sent even some patients at home because they didn't have money. So how can we work together to ensure that this is brought to success? So let us work together as a team, and Kenyans, please register for SHA so that you can access these services.
All right. We want to wish you all the very best.
Thank you.
And thank you very much for honoring us with your presence tonight. And of course, as you continue to discharge your duties, we wish you all the very best. We've been speaking to the Cabinet Secretary, Ministry of Health, the Dr. Deborah Barasa, who's really emphasized much really on the transition from NHIF to SHIF. It's over about 50 days really since the transition, and of course there's some progress made towards that end.